everyone. Thank you so much for joining me today. My name is Cheryl Logan, and I'm the Associate Director of Admissions here at Ashland University. And today we are excited to talk to you about our traditional nursing program. I have with me the chair of the nursing program, Juanita Reese Kline, as well as one of our current nursing students, Alena Holmes. She's actually in her final semester on campus, and she graduates next week. So we're so excited that she's able to join us today, having the opportunity to hear from one of our faculty members as well as one of our current students. It's really going to give you that perspective to kind of know and understand exactly what you can expect when you're on campus. So at this time, I'm going to turn it over to Juanita. Juanita, with my first question, I just would love if you could provide an overview of our traditional nursing program, please.
Sure. Thank you, Cheryl. Our nursing program is a 4-year program. It provides the student or the graduate with a Bachelor's of Science in Nursing degree. It starts on main campus. Students are there for the first 2 years, taking what I often refer to as their non-nursing courses mostly. Many of those courses are required non-nursing courses, like your sciences, your anatomy, physiology, your microbiology. Things of that nature. But there are other courses that some schools refer to as general education courses that Ashland University refers to as core courses. So those are done within your first 2 years. During your freshman year, you do take your first nursing course. It's a 1 credit hour course. I often refer to it as an introduction to nursing. It does have a different title than that, but it helps students to begin to recognize the many different things that nurses can do. And then during the second semester of their sophomore year, the students take their second and third nursing course. The first is pathophysiology, pharmacology, and the second is their health assessment course. After they complete those first 2 years on main campus in Ashland, then they come over to the Mansfield campus, to the nursing academic building, and at that point, it's strictly nursing from there on. So they begin clinical that very first semester, and they continue to do clinical through the remainder of their junior and senior year. Generally, they're doing at least 2 days of clinical each week. They're doing 1 or 2 days of lab each week. They're generally enrolled in about at least 4 nursing courses, so they're really immersed in nursing. As they progress through the program, they will be in the classroom, in the laboratory, as well as in clinical. The laboratories initially are rather traditional. However, if you do get an opportunity to tour our academic building on the Mansfield campus, you will see that it's a new building. It was designed specifically to deliver simulated laboratory experiences, meaning they simulate an actual clinical experience. So once the students complete their first semester of lab, then from there on, it's pure simulation using very high-level technology. We refer to that as high fidelity, where they have mannequins that function just like people, very much so anyway. You can take blood pressures, hear their heartbeats, feel their pulses in their feet, in their wrists, in their neck. They perspire, their pupils will dilate and constrict. They do all kinds of things. So we really are excited to be able to deliver those types of laboratory experiences to aid the student as they go into the actual clinical experience. They progress from caring for one patient in a clinical setting to caring for groups of patients. And as they finish off their clinical experience, just as Alena has done this final semester, they are paired with an RN to complete a minimum of 120 hours in a clinical setting, generally an acute care hospital type setting. So having shared that, I think it would be nice to hear from Alena and her perspective as a student finishing the program and what she recalls about the curriculum.
Thank you, Juanita. So as Juanita mentioned, I'm in my last semester of our nursing program. I graduate in a week, which I'm very excited about. So different things that I remember, I've been at Ashland for 5 years, and part of that just short kind of synopsis of that was I didn't start out in nursing. My first semester, I was actually a finance major, and around Thanksgiving, I realized that business was just not what I wanted to do with my career, and it wasn't giving me that sense of how much I wanted to help people. And so I switched to nursing, and I've been with nursing ever since. So 5 years is not, you can finish in 4. It's just my personal experience was 5. So what I remember about the beginning was, you're taking those anatomy courses, you're taking an elementary statistics course, you're also taking courses that are within our like core curriculum. So we have different art courses you can take, sociology courses, and things like that. So a lot of that at the beginning, just kind of remember that it's fundamental, especially the sciences and things that are specifically related to nursing, because those are going to come back later in your courses, your sophomore, junior, senior year. And because you've taken them in such detail at the beginning, it's just expected that you know that material later on. So the first 2 years, as Juanita mentioned, you're doing all of your core classes, and then you'll move to the nursing campus. So something for me that's different, but a lot of other students do this too, is I didn't live on our nursing campus, and that's an option as well, is you can live in our beautiful apartments on the nursing campus. But I chose to live on main campus, and the reason why was because I had roommates that were not nursing majors, and only nursing majors can live on the nursing campus. So I was also very actively involved on main campus, so trying to drive in the evening every day was just not something I wanted to do back to main campus. So just know that that is an option for you. And if you do choose to do that, a lot of students will carpool. I carpooled with a group of friends my first semester, and then after that, because we were at different points, whether it be different clinicals or different lab times or something like that, we ended up commuting like separately. But it really isn't a bad commute. It's about 25 minutes. So I didn't really mind commuting. And really in those last 2 years, something that I would highly encourage is all of our faculty are very welcoming and very understanding of the student experience. So I would recommend that if you're stressed about something, if it's the class or if it's something just going on in your personal life, all of our professors really do have that open door policy, and they really do practice that. So I would highly recommend talking with them. They want to get to know you more than just a nursing student. They want to get to know you personally and things like that. And they want you to get to know them as well. So just know that they are resources for you. Actually, Juanita is my advisor, so I've been in her office, I can't remember how many times, talking about different things I was going through or something like that, and with several other faculty as well. So just know that the faculty really is there to help you, and they understand because they were there too. So I just really encourage using them as a resource. And I think that's about all I have at the moment about our amazing nursing program that I'm very happy to have be graduating from in the next week.
Thank you. And speaking of the clinical hours that you guys were talking about, I know Juanita, you talked about the hours, and then with Alena, you just completed that precept that we were talking about earlier. Would you be able to give the students an idea of what type of rotations they'll actually complete?
So when they start off, they come into a course named Health Foundations 1, and it has a companion course named Health Foundations 2. They start off in a nursing home or long-term care setting. It's a little less stressful as they learn really basic skills. So they often will care for the same resident, but they will often also care for additional residents. So it's not just a single resident. But we prepare them a little less anxiety-producing, if you will, to move then into the acute care setting, the hospital care setting. And they just transition so very nicely and much more smoothly typically. We like when they have the same clinical instructor that goes right along with them from that first to the second clinical setting. Their second semester of their junior year, they're taking a psych mental health course. So they're learning therapeutic communication, which as faculty, we really very much believe that therapeutic communication is needed everywhere a nurse works. It does not matter what type of environment. It's teaching you how to effectively communicate with folks. But you also start your medical surgical courses. They have other names than that. But you really get a very good flavor of a variety of types of patients who have acute as well as chronic illnesses. Again, they're in a hospital setting. They move on to their senior year. They take an OB course or a mother-baby course, learning about moms during their pregnancy, delivery, and after delivery during the postpartum period, how to care for that newborn. They also are taking a pediatric course. They go to pediatric hospitals located in Columbus or Akron. They'll go to one or the other city to their children's hospitals. During all of this time, they're typically caring for one patient. As they progress, they may be caring for two patients. As they continue in doing OB and peds, they'll do one for 8 weeks and the other for 8 weeks. Across the whole 16 weeks, they're taking a third course called Complex Health. It's like an advanced medical surgical course. And at that point, they're really starting to take care of patients who are complexly ill. Not necessarily critically ill, they could be, but they may be someone like a person who has diabetes, and they not only have that disease, but that disease has led to other disease processes like heart disease, kidney disease, peripheral vascular disease. Diabetes has a lot of complications after many years, and so the patient becomes very complex in the care that they require. Then they move on to their final semester where they do the preceptorship. They're caring for a group of patients in a hospital just like an RN would. They're also taking a community health course. That's something that distinguishes the BSN student from other type of RN graduates. And they are also doing an advanced simulation course. So they've been doing simulation all along, but now instead of caring for one simulated patient, they may be caring for 4 or more simulated patients. So we have those mannequins that are very high tech. We have real people playing the part of the patient. We have real people often playing the parts of family members, because remember, as nurses, we also care for the family. So that's what clinical looks like. And I think you asked a different part to that question, Cheryl. I don't remember what it was.
Yes, so with that, I was talking to Alena about her preceptorship that she completed earlier in the semester.
So tell us a little bit about that.
Okay. So your preceptorship, what that is, so as Juanita's mentioned, you have all of these different rotations, and basically the point at the very end of the program is, for some people, you can call it preceptorship or capstone. It's kind of like interchangeable and it means the same thing. So it's 120 hours that you're doing, and you get to help pick the area you want to go into. For example, for me, I really like med surg, so I wanted more experience in that. Other people, they want to do the ED or the ICU or something of that nature. And you also get to pick some of the facilities that you want to be at, and we try to get you the area you want and the facility that you want. So I was at a hospital in Mansfield, and I was on a med-surg floor that was 31 beds, and then 7 of those happened to be peds. So the nurse that I was paired with, she did both. So I got a little extra peds with that, which I didn't really mind. So that experience for me, I know at first I was like, yes, I'm finally at the end. This is kind of that last time to prepare before you're a nurse, because you're working towards taking over that nurse's patient load. So I think it's by the end you're supposed to take over 80%. For me, I took over my nurse's full load. So what the 80% means is if they take care of 5 patients that day, you're supposed to take care of 4 out of the 5 by the very end. So what I liked about that is usually in your previous semesters with clinical, you are in a group of 6 to 7 other students with a clinical instructor, and you have nurses on the floor. So sometimes when you're in that setting, it's kind of hard for you to get to follow the nurse all day and take all of their patients, because you have 1 or 2 designated patients. So I liked that when you are just with that nurse, it's just the 2 of you, and you go along with them and you do everything that they do as long as it's in your scope of practice. There's certain things as student nurses that we're not allowed to do. So what I liked was that, it helped me develop that time management. When you're taking care of 4 or 5 patients in the morning and you have to assess them, you have to give them their meds. They may have all these other treatments like dressing changes and things like that. So for me, that experience was really great because it helped me feel like I was kind of stepping away from that student nurse role and really into the nurse role. And it helped me with that transition. So I know by the end, I felt really great because I'm like, I feel like a nurse. It's not that you don't before that, but when you're really doing more with patients, it makes you feel like a nurse, and you're really excited because you're like, I do have this. I can be a nurse. I can do it. And it just gives you that last little bit of confidence boost that you need. So that was my experience, and I had a wonderful experience. I loved the floor I was on. All of the nurses were amazing, and the different aides, and just anyone who worked on that floor. It was a very great atmosphere to be in. And that's something that I know in our leadership class we talk about when you're job searching, is to find a floor that has a very good atmosphere, because that first year is very difficult. So for me, it was nice during all of my clinical experiences, and especially that one where you're spending more time on a floor and precepting, that you see what a good atmosphere is to work in, because that's what you want when you leave. So that's kind of my experience with precepting. I'm not sure if that fully answered the question, or if you want me to answer more. So.
No, that was great. And you're speaking about being at a hospital in Mansfield. Where do the students do their clinicals? How far do we go from the Mansfield location?
Clinicals are done in a variety of places. We're located, the college is in Mansfield, so we go a radius out. It could involve anywhere in the state of Ohio. Typically, it isn't everywhere in Ohio. It's mostly around the north central Ohio area. So Ashland University is located in Ashland County. Mansfield is located in Richland County. So those counties we use a lot. We do go to Akron and Columbus for pediatrics, as I mentioned before. Often that's the furthest folks will drive. But we do have clinicals that go up into the Cleveland area. We have contracts with many, many healthcare facilities. So we go up there into Cleveland Clinic, university hospitals. We use Ohio Health a lot. Ohio Health is our largest healthcare system, located just slightly over a mile from the Mansfield campus. You could walk there if you had to, let me tell you. It's not that far. But we do a lot of clinicals there because it is our largest clinical facility. But Ohio Health is located throughout Ohio. So it has been on occasion that students go to Ohio Health in the Columbus area, where they're largely located. So pretty much every facility that could provide long-term care, and certainly acute care, community health care, we probably have a contract with that facility. So students will need to have their own transportation. Alena mentioned carpooling. A lot of students will take turns and share, that drive. But generally, I would say most of the time they're not traveling more than 30 minutes to get to a facility. And sometimes it may just be a few minutes. Would you agree, Alena?
Generally, yeah, it's pretty close. I think the farthest I had to drive, it was either a half hour, which is when I was going from Ashland. I had was when I had peds in Akron, and I also had my complex clinical in Akron. So that was about 50 minutes drive. And it's really not that bad. It's just kind of where the area is with peds hospitals. Those, as Juanita mentioned, those two really are like the farthest. And then also with any other clinical, say someone lives around the Cleveland area, they may want to do clinical around Cleveland or Columbus or whatever close to home. And with precepting, that's kind of, it depends on where you're wanting to go and where you live and things like that. But usually it's within the half hour. But like I said, when you're going to Columbus or Akron from Mansfield or Ashland, it could be about an hour.
Yeah. And of course, when we talk about driving time or travel time, like just traveling between Ashland and Mansfield, it really doesn't take 30 minutes or even 25 minutes to get between each campus. It's walking from the building to the parking lot, driving, which maybe really only takes 15 to 20 minutes at the most, and then getting out of your car, after you park. It's the whole experience. So whoever's watching this, it really doesn't take 30 minutes to get between Mansfield and Ashland. But by the time you leave the building and you get there and do all the things you have to do to get from one meeting or one class to another, you do take up about 30 minutes, but travel time isn't that long. That's probably more than you wanted to know.
Hey, we appreciate it though. Now with that, Juanita, do you guys offer any certifications for students before graduation?
Oh, we do. In fact, we're pretty unique in terms of certifications. It's not that we're the only school, but we are one among very few that offer certification in advanced cardiac life support as well as advanced stroke life support. Our employers, when students go out to interview, that usually catches their attention. I do believe it does kind of differentiate one among many things that an employer and nurse manager will look at, and that might mean the difference between you getting that position and someone else. But I know employers really like that certification in those two areas. We can't hear you.
Yes. Alena, did you have the opportunity to take part in either of those certifications?
I did. I got the stroke course. When you take that, it's your second to last semester in your ACLS or your advanced cardiac life support. You get that in your very last semester. So I was able to get both of those. And also in community, we get one that is from FEMA, and it's related to kind of like disaster response and things like that. It's just you get one of the two. It's just kind of like personal preference. So there's also those. And I know where I just started applying to different jobs. I'm actually talking to a recruiter tomorrow. But I'm sure that those are different things that probably was very, as Juanita mentioned, like eye-catching, because I know talking with different faculty and different people that usually nursing students with a BSN do not graduate with either of those. And also if you're going to be in an ICU or a telemetry unit, which is where it's like cardiac monitoring and things like that, they usually have you get those anyway. So graduating with those is nice because then they don't have to have you get them later or within, I think it's like the first 6 months from what I'm seeing of you getting hired, having to get those.
Thank you. My final question for both of you, from the faculty perspective as well as the student perspective, what do you think sets Ashland University's nursing program apart from all of the other nursing programs?
Well, I think there's several things. One of the things that the university talks a lot about is accent on the individual. However, that's not just a bunch of words or a few words, it's the reality, and I think Alena attested to that earlier. One of the reasons I really love teaching at Ashland University is because we do get to know our students. And that's very exciting, and as an instructor, it's very rewarding. It's wonderful to see students like Alena, I call it blossoming and ready to graduate. That is just really wonderful to be a part of that and see that happen. Other things that set us apart, we do very well with our NCLEX scores. That's the national licensing exam that all nurses or all graduates have to take in order to be able to receive their license to be a registered nurse. We've done very well for the last many years. We're usually scoring well over 90%. The year before last, we were at 95% pass rate. In 2019, we were at 94.44% pass rate. That is really very good. So I'm really proud of our graduates and how hard they work and how hard the faculty work. And then I would also say what sets us apart. We hear this a lot from our graduates and even from those who employ our graduates, and that is our emphasis on our eye care values. If you walk up the steps from the front entrance, you will see them written, these words written on the steps. They're the values that we all very much embrace. They stand for integrity, caring, accountability, respect, and excellence. And any one of us, faculty as well as students, can articulate what each one of those mean to them individually, as well as what those values mean to our nursing profession.
Thank you. Alena, do you want to add anything?
Well, Juanita hit all of the things I was going to mention, so that's something. But I think just different things she mentioned, especially the eye care values. I know that something for me that I like is on the nursing campus and just like Ashland in general, something that I appreciate about the faculty is that what they're telling you to do, they do that themselves. It's not, and I'm not saying that they do that at other universities, but I'm just saying that it's nice that when you're having someone tell you something, or they say these are the things that we think you should live by going into the profession that you're going into, like they do that themselves. It's not like contradictory or anything like that. So I just love that they hold us to high standards, which when we're talking about the nursing profession, you need to be held to high standards because you have patients' lives in your hands. You have people that you are taking care of every day that you are responsible for. So I just love that they hold us to high standards because they know that if they hold us to lower standards, that's not going to help us when we graduate. And as I mentioned earlier, just different things with the faculty. I know something that impressed me my first 2 or kind of 3 semesters on the nursing campus was the atmosphere on Ashland in general. If you're walking past someone you don't know, like you smile at them, or you might ask how their day is or how they are, or just say hi. And that's like that on our nursing campus as well. What I thought was interesting for me was there has been multiple faculty that I hadn't had in a class yet, and they got to know me and know my name before I even had them. So that's something that I think is very unique. And it's just like I said, they embrace getting to know students, and they want to know how you're doing. They don't want you to just say that you're fine when you're not. Like, they ask you those questions because they are there as a support for you. So I know for me to be a part of such a loving and caring environment has helped me through the difficulties of nursing school, and just other things as well. It helps you get through it knowing that people care. And it's not just a fake care. They genuinely care for you, and they want you to be successful. They want you to graduate and become the nurse that you wanted to be, because they had that dream too, and they are now. So it's just the atmosphere in general. It's just, I feel so lucky to go to a school that it's like that, where I feel so supported versus not. So that's about all I can say about the nursing program. So.
Yes, thank you. It sounds like you've had a great time on campus. It was really wonderful hearing from both of you. And before we finish this, I have a few pictures of the nursing school that I would like to share with you guys. Juanita provided this earlier, so just taking you through as we show you. And then once we conclude, I will go ahead and let you guys know what the admissions requirements are for the nursing program. But as you can see on this first page, this is the front of our College of Nursing. And up here, you cannot really see it, but Dwight Schar College of Nursing. So Dwight Schar has been a wonderful asset to Ashland University. He's donated a lot of money for a lot of great buildings, a lot of great programs, and we appreciate him so much. So as we go through to the second one, you can see the back of the College of Nursing facility lit up at night. Now, from these pictures, you can't see it, but pretending like you're behind that camera, that's where our College of Nursing residence halls are located. We have 2 of them back there. Then we get into actually seeing the Schars. So Mr. Schar and his wife, as well as our Tuffy the Eagle mascot, we have about 26 of those little eagles on campus around all over. We have Old Abe. He's our largest by our recreation center, but essentially any building that you go into, you're going to be seeing one of our little Tuffy Eagles outside. Then the nursing curricular framework, we talked about this a little bit, but I really want to get into those I care values that Juanita and Alena just mentioned. And as you can see on the stairs, they're literally written out on the stairs. So these are values that they aspire to live by every single day in their personal lives as well as their professional lives in the nursing program. Talked about those 4 courses that you're going to be taking as well as your clinical hours. The faculty interaction, this just goes back to our accent on the individual. So knowing that you are truly a student that is cared about every single day, and not just another number in the class. Our cafe and campus store. So you don't have the main dining hall like you do on main campus, but you have the opportunity to be able to stop in, grab some AU attire. They've got a few sandwiches, a few little things here and there that you can utilize through that campus bookstore. Some of the apparel that you can see. And then this is an example of one of our classrooms. The simulators you can see in the back, just like Juanita and Alena were both talking about, you've got access to them. They're fully functioning. So having that opportunity to check the pulse, whether it be in the neck and the wrist and the foot, all of the places that Juanita was talking about. You've got access to these patients. As we go through, you can just see. And Juanita and Alena, feel free if you want me to stop or say anything.
Well, the last two pictures you just showed is our OB lab. We have mothers that can deliver babies all day long. And we always like to remind our students that when they're caring for mom, they're also caring for baby, so they have at least 2 patients. And the picture before that was our pediatric lab. So you can care for little ones of various stages. So the furthest bed over is a very young child, where the bed closer to us is probably a school-age child. And they simulate things too. We have one simulator that we often take out when we recruit, and the little guy's eating a grape and he gets choked on it and he starts to turn blue, literally. So they do the same things as simulators as what can happen with people.
Would you like to talk about
this is just a group of scholars. They were the recipient of a medical mutual scholarship. We've had this scholarship for several years, and this was just one particular cohort of students who were recipients of that scholarship, which we were very grateful for. And then this is the conclusion of the nursing education experience at Ashland University the evening before graduation. Graduation's on a Saturday morning typically. So on Friday evening before, we have what's referred to as our recognition ceremony. It used to be called the pinning ceremony because you receive your nursing pin, which is unique to your nursing program. Nurses used to always wear these pins on their uniforms. Most of the time nurses don't do that now. They might for professional occasions. But also at this event, and Alena can speak more to this than I because she has served as president of the organization. They're doing blessing of the hands. So you want to talk briefly about that, Alena?
Yes. So the group that is responsible for this, it's our NCF group, which stands for Nurses Christian Fellowship. It's a national group, and they have different chapters per se on campuses across, the U.S. So ours, with the blessing of the hand ceremony, it's really special. Is where students can come up and their family can come up too once they're done with the students. But what they do is you'll put your palms out and you'll have your hands blessed by 2 of our nursing faculty. I believe in this picture there's 4 of them up there. So it's just, passing on that knowledge and blessing your hands as you're going out into the workforce. And it's a really special time, and we share some scripture and things like that. So it is really special, and we usually do that after the pinning, the nursing recognition ceremony, the pinning ceremony. Usually the blessing of the hands is after that on the same evening.
Yeah, so there are 2 different ceremonies back to back. You can choose to participate or not, although I will say to you that these 2 ceremonies we learn from students often are just as meaningful as the actual graduation ceremony because it's so unique to nursing, and it reflects all that students have done as nursing students in order to get to where they are as a graduate.
Now with that, so the last things that I want to talk about, like I mentioned, were the admissions requirements. One of the things that I think sets Ashland University apart as well is our direct admit nursing program. That means if you meet our direct admission requirements, you start in that anatomy and physiology class that both Juanita and Alena were talking about first semester of freshman year. And when you complete your 2 years here on main campus, as long as you've maintained the required GPA to stay an active part of that nursing program, you start in that first semester of junior year in your clinical rotations. So you're not reapplying to the nursing program. You apply to it one time and you gain that admission, and you continue through that 4-year time frame. Like Alena mentioned, she's going to be finishing her 5th year, but switching from that finance major to the nursing side of things. Our program and curriculum is designed to get you in and out in that 4-year time span. So it's something that we really pride ourselves on being able to do that. And those direct admissions requirements, it's a 3.0 GPA and a 20 ACT or a 1030 SAT. And if you are a junior or a senior and you're looking into this program, seniors, you can apply right now. Juniors, you can apply at the conclusion of your junior year. We're rolling admission with a free application. So once we receive your application, transcripts, and test scores, we can make that admission decision for you pretty quickly and let you know whether or not you've been accepted. So I appreciate all of your time. I'm thankful that you were all able to join us, and I hope you guys have a great day. Thank you so much.